I think for me, this is an opportunity to meet with other professionals who are involved in providing end-of-life care. It's complicated, it's really important to get it right, and I'm often making referrals to people that I don't get a chance to actually speak to or work alongside. So the chance to meet some of those people and learn from them, as well as get to know them and the details of what they're able to provide and do, I think is really valuable. One of the complex issues in end-of-life care is around the different boundaries that we see on the ground in healthcare. So I work in a practice in Edgware where approximately a third of our patient population actually live in Harrow, but our practice comes under Barnet. So there are some of the services that I will get involved, like the district nurses, they will cover all of the patients in our area. But things like palliative care, there are two completely separate organisations for specialised palliative care. That's the North London Hospice and St Luke's, and they're completely different teams, completely different organisations. So a lot of the time I have to make sure I'm getting the right referral to the right person, not just by speciality or expertise, but also the geographical area that's involved. So for me, going back to my practice in Edgware, I'll be looking at what those pathways are so that I can make sure that the other doctors that I work with are aware of the pathways.
I think what I'm really hoping to get out of today is the very fact that we're all coming together to talk about this topic. I work in palliative care, end-of-life care. It's my normal business, but it's everybody's business, and it's so exciting having the GPs here, the district nurses, the social workers, London Ambulance, and that we're sharing a conversation, we're having a debate about let's take what we do well and let's make it even better and try and get it right for everybody every time. I just think it's really exciting.
And what do you think are the key issues facing palliative care in a soundbite?
I think the key issues are around communication and coordination. I think everybody's working hard, but are we always talking together? So it's bringing us together, communicating better. Yeah. I think it's wonderful that the CEPN has managed to bring us together. I think that they have the ability to pull together all these different professionals, and I think it's the first time I really have a sense of us working together, primary care, secondary care. So I think what the CEPN have achieved here is really exciting. There's a lot of passion, there's a lot of enthusiasm in the room. I'm hoping that at the North London Hospice people realise it's not just us doing the palliative care, that we can forge even better and stronger working relationships with our primary and secondary care colleagues, and that we're in this together trying to improve end-of-life care.
I think for me it's what I've learned from speaking to the paramedic who was in our group about the use of CMC, Coordinate My Care, and the value that holds for them as professionals working out of hours and trying to meet the needs of people when we're not in surgery and easily accessible. I do a lot of end-of-life work, but I've really learned valuable things today that I'll be taking away.
Okay, thank you.